If you're over 60 and you felt more tired lately, slightly less steady, or mentally slower than you used to be, it may not just be aging. Sometimes it's something much simpler. There are three very common blood tests that many adults overlook, and missing them can quietly affect your energy, your balance, and your clarity. Energy may dip, balance may feel less steady, memory may feel slightly slower. If you've noticed changes like these, let us know in the comments. Most people assume these changes are simply part of aging, and sometimes they are. But sometimes, small internal imbalances are contributing more than we realize. Imbalances that can often be detected early with a few basic blood tests. If this is helpful, a quick like helps others find these tips. Hello, I'm Dr. Michael Carter. On this channel, we focus on practical, evidence-based health insights for adults over 60. Today, we'll cover 3 blood tests that many adults over 60 should consider discussing with their healthcare provider, especially if you've noticed changes in energy, strength, or steadiness. This is not about fear, it's about awareness, because awareness gives you options. Why blood tests matter after 60. As we get older, the body changes in ways that affect how we absorb nutrients, how we carry oxygen, and how we recover from stress. Even if you feel mostly fine, your internal baseline may be shifting. Aging can reduce stomach acid production, which changes how some nutrients are absorbed. Muscle tissue can become less efficient at using nutrients, which affects strength and endurance. Inflammation patterns can shift over time, affecting energy and recovery, and mild anemia can appear gradually, quietly lowering stamina. The tricky part is that early imbalances rarely feel dramatic. They often feel like, I'm just more tired these days. I don't feel as steady as before. I'm a bit more foggy sometimes. I take longer to recover. Those might be normal aging changes, but they can also be signals that it's time to check the basics. Blood tests don't diagnose everything. They don't replace clinical judgment, but they provide useful data that helps your doctor ask better questions. And after 60, one of the most valuable ideas is this: track trends, not just one-time numbers. A single result is a snapshot. A pattern over time tells a story. One more important point: numbers should always be interpreted in context. A result that is borderline may be completely fine for one person and worth monitoring for another. This is why it's best to use testing as a conversation starter with your healthcare provider, not as a reason to self-diagnose. Now let's start with the first test. If you're interested in simple, practical health insights like this, consider subscribing so you don't miss our upcoming videos. Test number 1, vitamin B12. Vitamin B12 supports 2 major systems. 1, blood health, because it helps produce healthy red blood cells. 2, nerve health, because it supports nerve signaling and brain function. After 60, B12 deficiency becomes more common, not necessarily because people eat poorly, but because absorption declines. B12 absorption depends on adequate stomach acid and a protein called intrinsic factor. As we age, stomach acid can decrease. Some medications can also interfere with absorption, such as certain acid reducers, and in some cases medications used for blood sugar control. So it's possible to eat enough B12 and still have low usable levels. Why B12 deficiency is often missed is simple. Early symptoms are vague and overlap with normal aging. Subtle signs may include fatigue that feels persistent or different from your usual tiredness, tingling or numbness in the hands or feet, mild balance changes or feeling less steady on stairs, slower thinking, brain fog, or trouble concentrating, mood shifts, irritability, or feeling flat. None of these symptoms automatically mean your B12 is low, but they are exactly the kind of signals that deserve a calm, informed check, especially if they are new or gradually increasing. Here are 2 everyday examples. Example 1. You notice your feet feel slightly numb at night, or you don't feel as confident walking in low light. Example 2. You feel tired even after a full night's sleep, and coffee doesn't seem to make much difference. These situations can have many causes, but B12 is one of the simplest things to verify. Another example, if you feel off balance but your ears feel fine and you're not dizzy in the classic sense, sometimes nerve-related factors can play a role. B12 isn't the only possibility, but it's one of the easiest to rule in or out. Why does this matter after 60? Because nerve health affects independence, how steady you feel, how you react to uneven surfaces, and how safely you move through your day. Also, B12 supports red blood cell production. If B12 is low, it can contribute to anemia-like fatigue, which means you may feel drained even when you sleep well. That's why B12 is useful when the main complaint is, I'm tired, but I don't know why. If B12 is low and it's identified early, management is often straightforward under medical supervision. Depending on the cause, a provider may recommend diet adjustments, oral supplementation, or, in some cases, B12 injections. When you speak with your clinician, a useful question is, do my symptoms and my results suggest I'm absorbing B12 properly, or do I need a different approach? B12 is a high-value test to track after 60, especially if energy, sensation, or balance changes appear. Test number 2, vitamin D. Vitamin D is best known for bone strength, but after 60, it also matters for muscle function and balance. Vitamin D influences muscle contraction and strength, coordination and reaction time, immune function, inflammation regulation. Even in sunny places, low vitamin D is common. Skin becomes less efficient at synthesizing vitamin D from sunlight as we age. Many people spend less time outdoors. Dietary intake often isn't enough to compensate, and some health conditions can affect metabolism. Low vitamin D doesn't always cause obvious symptoms. Sometimes it shows up as general tiredness, reduced leg strength, slower recovery after activity, feeling less stable, especially when turning or stepping down, mood changes during certain periods. Again, these are not specific symptoms, and many things can cause them. But vitamin D is one of the easier factors to check and correct safely when needed. Why it matters after 60? Falls are one of the biggest threats to independence. Even mild weakness can increase fall risk. Vitamin D is not the only answer, but it is one important piece of the strength and balance puzzle. Think about it this way. Strong bones matter, but strong muscles and good balance are what prevent the fall in the first place. Vitamin D supports muscle performance and may help reduce the risk of weakness that sneaks up gradually. A practical clue is this. If you feel your legs fatigue quickly on stairs, or you avoid certain movements because you feel less steady, it's worth checking the basics. Vitamin D alone won't fix everything, but it can be a meaningful piece of the foundation. If your levels are low, your healthcare provider can advise a sensible approach. The goal is not mega doses. The goal is appropriate levels that support strength, confidence, and resilience. One more practical point. If you've had less sunlight exposure recently because of lifestyle, work, or simply preference, vitamin D levels may drift down over time. A simple blood test can clarify whether this is part of your current health picture. Test number 3, complete blood count, CBC. A complete blood count, often called a CBC, may sound routine, but it's one of the most informative overview tests available. A CBC measures red blood cells and hemoglobin, oxygen delivery; white blood cells, immune activity; platelets, clotting and healing. After 60, one common issue is mild anemia, meaning the blood carries less oxygen than it should. When oxygen delivery is lower, everything can feel harder. You may notice you get tired sooner than usual, stares feel heavier, shortness of breath appears earlier, exercise tolerance declines, mental clarity feels slightly reduced. Early signs of anemia can include persistent fatigue, lightheadedness, reduced stamina, or shortness of breath with mild exertion. Because these changes develop gradually, many people assume they are just part of aging. A CBC helps reveal whether oxygen delivery might be part of the picture. It can also provide clues about immune activity. Changes in white blood cell patterns can reflect how the immune system is responding to stressors. Platelets provide insight into clotting and healing capacity. A CBC does not diagnose the cause by itself, but it gives your healthcare provider a clearer starting point. Here's an example of why that matters. If someone feels fatigued and assumes they're just slowing down, a CBC may show mild anemia. That doesn't immediately tell you why, but it tells you the right next question. What is contributing to lower oxygen delivery? And even if your CBC is normal, that's useful too. It helps narrow possibilities and can prevent you from chasing unnecessary supplements or worrying about the wrong thing. The real power of the CBC is baseline tracking. If you repeat it periodically, you can see whether values remain stable or drift over time. That's the difference between guessing and monitoring. How to use these results wisely. A helpful way to approach these tests is not, "I need perfect numbers." Instead, think, "I want to understand my baseline and watch for changes." When you get results, consider asking your provider, "Are my results stable compared to previous tests? Is anything trending in a direction we should monitor? Do my symptoms match anything we're seeing?" This keeps your care practical and personalized and helps you avoid unnecessary worry. Practical steps you can take now. Before we close, here's a simple way to prepare for your next checkup. Write down any subtle changes you've noticed in the last 6 to 12 months. Fatigue that feels different from your usual tiredness. Changes in balance or confidence walking. Mild tingling or numbness. Slower recovery after activity. Reduced stamina compared to last year. Then bring calm, focused questions. Would it make sense to review my B12 level? Should we check vitamin D based on my sun exposure and activity? Are my blood counts stable compared to previous results? This approach shifts the visit from reactive to proactive. The goal isn't perfect numbers, it's awareness, consistency, and partnership with your healthcare provider. What not to do. One quick caution. After you learn about these tests, it can be tempting to self-diagnose or to start supplements aggressively. Instead, avoid these common mistakes. Don't interpret a single number in isolation without context. Don't chase perfect results if your clinician says your baseline is stable. Don't start high-dose supplements without guidance. More is not always better. And don't ignore symptoms simply because a value is in range. The best approach is calm and practical. Use testing to guide a conversation, then make simple adjustments with professional input. After 60, awareness becomes one of your strongest health tools. B12 supports nerves and brain clarity. Vitamin D supports strength and balance, and a CBC gives a broad snapshot of oxygen delivery and immune activity. These are practical starting points to discuss with your healthcare provider. If you want to remember this in one simple way, if this helped you, subscribe for weekly health insights for adults over 60. Think of it like this. B12 helps keep your nerves and brain connected and supports healthy blood. Vitamin D supports the strength and balance you need for walking, stairs, and daily movement. And the CBC helps confirm whether your body is carrying oxygen efficiently, one of the biggest drivers of stamina. If your energy is lower than it used to be, or you feel less steady, these tests won't answer every question. But they often help you rule out common fixable issues first. That alone can save time, worry, and unnecessary trial and error. If you found this helpful, consider subscribing for more weekly health insights designed specifically for adults over 60. Staying informed is one of the simplest ways to protect your independence over time. This content is for educational purposes only and is not a substitute for personalized medical advice. Always consult your healthcare provider before making changes to your health routine or interpreting laboratory results. Subscribe and stay one step ahead.